staff to treat these people properly, most of these people could actually be healed, but they're not doing that. They're letting them die because they want the numbers to go up.
I'm a nurse practitioner. I am licensed and certified. I am not on the front lines. I have a friend in New York City who's on the front lines. And for her safety, she cannot come out and say these things. So I am her voice. I'm not going to name names of people or hospitals for the safety of those involved. But this is her account, okay? I am her voice here. I'm going to tell you what she has told me. She wants this to get out. In New York City right now, in some of the hospitals, this is what is going on. People are sick, but they don't have to stay sick. They are killing them. They are not helping them. She used the word murder, coming from a nurse who went to New York City expecting to help. Patients are left to rot and die. Her words. She has never seen so much neglect. No one cares. They are cold and they don't care anymore. It's the blind leading the blind. If they require more than 6 liters of nasal cannula, they get intubated, they go on the vent, or they get trached if there's not enough vents. They don't get high flow, no non-rebreather, no non-invasive ventilation, no CPAP, no BiPAP. They're on a closed system, the ventilator, which, by the way, I know a nurse in Florida who was fired for exposing that about CPAP and BiPAP and patients being put on the ventilator, like straight away to the ventilator. The patients don't know any better. They don't have family with them. There is no one there with them to advocate for them. So they are scared and they give consent. The ventilators have high PEEP, high pressure, which then causes barotrauma. It causes trauma to the lungs. Dr. Siddell, Cameron Kyle Siddell, a few weeks ago put out a video. He's in New York City, and he put out a video saying something is not right, like we're not treating this correctly. We're doing something wrong. This doesn't make sense. They pulled his video from YouTube and they took him out of ICU because they couldn't have one doctor going against the grain, going against their protocol. The protocol is propofol or some kind of sedation because they're on the ventilator, and IV antibiotics. She says this is a nightmare. It's out of a horror movie and I don't want to be a part of this. There are people who are a full code, and yet if they crash, they're not doing compressions because it will spread the virus. Full code, not doing compressions. Family is not there. They have no one to answer to. No one is being held accountable. A code was called and no one came. So sometimes they're not even resuscitating people. Again, left to rot and die. There are doctors all around the world sounding the alarms. These are the drugs that work. This is the pathophysiology of the disease. This is what's happening.